Have you ever sat in your doctor's office feeling that knot in your stomach while they recommend yet another cancer screening test? That moment, when they hand you that lab order and you wonder if this is really necessary at your age. I know exactly how confusing and overwhelming it can be when you're told these screenings are absolutely essential, but deep down, you question if they're really helping or just adding more stress and complications to your life. Seniors, beware. 4 routine checkups. That may do more harm than good against cancer. The medical establishment doesn't want you to know this, but certain cancer screenings that are pushed on older adults can sometimes lead to unnecessary procedures, anxiety, and even harmful treatments that won't actually improve your quality of life. Today I'm going to reveal the 4 common cancer screenings that might be doing more harm than good for seniors, information that many doctors won't share because they're following protocols designed for younger patients. By the end of this video, you'll have the knowledge to have a more informed conversation with your doctor and potentially avoid procedures that provide little benefit but carry significant risks. This information could literally save you from unnecessary suffering, so make sure you watch until the very end. Hey there, my friends. I'm so glad you're here today for this incredibly important conversation. Before we dive in, I'd love to know where you're watching from. Drop your location in the comments below so I can get to know you better. And if you have any questions about today's topic, feel free to ask them in the comments section as well. I try to respond to as many as I can. Also, if you're new here, go ahead and hit that subscribe button and bell icon. That way you'll never miss our weekly videos where we tackle the tough questions about senior health that most medical professionals don't have time to explain properly. Let me tell you about George, a 79-year-old retired teacher who came to me after being diagnosed with prostate cancer. He was scared, anxious, and preparing for a major surgery that would likely leave him incontinent and with erectile dysfunction. The cancer had been discovered during a routine PSA test his doctor had ordered, without much discussion about whether it was appropriate at his age. What George's doctor never explained was that the slow-growing cancer they found would likely never have caused him any symptoms in his lifetime. But now, because of that routine screening, he was facing treatments that would significantly reduce his quality of life. Cases like George's are exactly why I'm making this video today. After much discussion about risks versus benefits, George opted for active surveillance instead of immediate treatment. 3 years later, he's still enjoying his retirement, traveling with his wife, and experiencing no symptoms from his cancer. The aggressive treatment would have robbed him of these precious years of quality life. Let's pause for a moment because I want to ask you something important. Have you or a loved one experienced complications or side effects from cancer screenings or subsequent treatments? What has been your experience with cancer screenings as you've gotten older? You know, many people feel alone in questioning whether all these tests are necessary, as if doubting medical advice makes them irresponsible. I understand how isolating it can feel when you're trying to make the best decisions for your health, but aren't sure if more testing is always better. This is especially true when you might be facing different health priorities than you did decades ago. If you'd like to share your experience, you can simply copy. My experience with cancer screenings has been, and then tell us your story. It doesn't need to be lengthy, just a few words about your thoughts or experiences. Your comment might be exactly what another viewer needs to read to feel validated in their own concerns. Plus, your experiences help me create content that addresses the real challenges you're facing. Remember, this is a judgment-free zone where we can have honest conversations about the complexities of healthcare for seniors. Now, let's dive into the first routine checkup that might be doing more harm than good for seniors. The PSA blood test for prostate cancer. The PSA, or prostate-specific antigen test, has been widely promoted as a way to detect prostate cancer early. However, what many doctors don't explain is that as men age, their PSA levels naturally rise, leading to many false positives. In fact, studies have shown that up to 80% of positive PSA results in men over 70 are false alarms. Think about that for a moment. That means 8 out of 10 men who get concerning results and go through the stress, additional testing, and sometimes even treatments, never actually needed any intervention at all. The United States Preventive Services Task Force now recommends against PSA screening for men over 70, and some experts suggest stopping even earlier for men with other health conditions. Here's why this matters so much. Prostate cancer in older men is often very slow growing. Many men who develop prostate cancer in their 70s and 80s will die with the cancer, not from it. It's often so slow that it would never cause symptoms during their lifetime, but once that positive PSA result comes back, it sets off a cascade of interventions. First comes the anxiety, waiting for more tests. Then there's the prostate biopsy, which itself carries risks of infection, bleeding, and pain. If cancer is found, even a small, low-risk cancer that would never cause problems, many men feel they must treat it. Treatments like surgery and radiation can lead to urinary incontinence and sexual dysfunction in high percentages of patients. One large European study found that to prevent one death from prostate cancer, 1,410 men would need to be screened, and 48 men would need to receive treatment. That means 47 men suffered side effects from treatment without any survival benefit. Have you ever wondered why your doctor might not share these statistics with you? Often, it's because the medical system is designed to do something rather than nothing, even when nothing might be the better approach. The fear of missing a cancer diagnosis drives much of this overscreening, but at what cost to your quality of life? If you're over 70 and your doctor recommends a PSA test, it's worth asking, how would the results of this test change my treatment decisions? If you're not willing to undergo prostate cancer treatment due to the side effects, or if your life expectancy is less than 10 years due to other health conditions, screening may not be beneficial. Instead, monitoring for actual symptoms like difficulty urinating or blood in the urine might be a more appropriate approach. Remember, it's not about avoiding all medical care, but about making informed decisions based on your specific situation, age, and health priorities. The second checkup that deserves scrutiny is mammography for women over 75. Mammograms have long been considered essential for breast cancer detection, but the evidence for their benefit in very elderly women is surprisingly weak. The American Cancer Society now acknowledges that women should continue screening as long as their overall health is good, and they have a life expectancy of at least 10 years. But here's what's rarely discussed. The rate of false positives increases substantially in older women. As breast tissue becomes less dense with age, abnormalities can appear more frequently on mammograms, leading to additional testing and anxiety. In a study published in the Journal of the National Cancer Institute, researchers found that for every 1,000 women in their 80s screened, there were 125 false positive results leading to additional testing, but only 2 to 3 lives were extended through early detection. Those are not great odds when you consider the emotional toll. Let me tell you about Eleanor, an 82-year-old woman who came to me after her mammogram showed a suspicious area. She underwent a surgical biopsy that revealed it was benign, but the procedure led to an infection that required hospitalization. During her recovery, she lost significant mobility and never returned to her previous level of independence. All of this stemmed from a screening test that, statistically speaking, was unlikely to benefit her at her age. When considering mammography after 75, it's important to think about competing health risks. If a woman has heart disease, diabetes, or other conditions that limit life expectancy, the potential harms of screening may outweigh the benefits. Radiation exposure, while small from a single mammogram, accumulates over time, and unnecessary biopsies carry risks of infection, bleeding, and psychological distress. Here's what's rarely discussed. Some breast cancers detected in very elderly women are so slow-growing that they would never cause symptoms during the woman's natural lifespan. In medical terms, this is called overdiagnosis, finding a cancer that would never have caused harm. Treatment of these overdiagnosed cancers exposes women to all the side effects of cancer therapy without any meaningful benefit. If you're a woman over 75, it's worth having an honest conversation with your doctor about the actual benefits versus risks of continued mammography. Ask questions like, based on my overall health and other medical conditions, what are the chances that finding an early breast cancer would extend my life? And what are the risks of false positives and overdiagnosis at my age? For many women, a shift to breast awareness and reporting any changes to their doctor may be more appropriate than continued routine mammography. Have you ever felt like making these kinds of decisions is overwhelming? That's completely normal. The key is to align your healthcare choices with your values and goals for this stage of life, rather than simply following the same screening schedule you've had for decades. Our third, potentially problematic screening is the full-body CT scan, often marketed directly to consumers as a way to detect cancer early. These scans are rarely covered by insurance for screening purposes, but many seniors pay out of pocket, believing they're making a smart investment in preventive health. However, the reality is far more complicated. Full-body CT scans deliver a significant radiation dose, up to 100 times that of a chest X-ray. This radiation exposure isn't trivial, especially when repeated over time. The National Academy of Sciences has concluded that even low doses of radiation pose some cancer risk, and this risk accumulates over a lifetime. So, ironically, a test marketed to find cancer might actually increase your risk of developing it. But the radiation isn't even the biggest problem. The real issue is what radiologists call incidental findings, abnormalities that show up on the scan that would never have caused symptoms or health problems. Studies have found that more than 30% of full-body CT scans detect such incidental findings, leading to a cascade of additional tests. Take the case of Robert, a healthy 76-year-old who decided to get a full-body scan as a birthday gift to himself. The scan found a small spot on his liver. This led to multiple follow-up scans, a biopsy, and months of anxiety before determining it was a completely harmless benign lesion that would never have caused any problems. During those months of uncertainty, Robert stopped traveling, put major life decisions on hold, and experienced significant anxiety and depression. Was the peace of mind worth it? In his case, the screening created far more problems than it solved. The Society of Radiologists explicitly recommends against whole-body CT screening for individuals without symptoms. Yet these scans continue to be marketed aggressively to seniors, playing on fears of undetected disease. If you're considering a full-body CT scan, ask yourself, what will I do with the information? If small, non-specific findings would cause you significant anxiety, or if you're not willing to undergo potentially invasive follow-up testing, this type of screening may cause more harm than good. A more targeted approach based on your specific risk factors and family history, developed in consultation with your primary care physician, is likely to be more beneficial than a shotgun approach that looks for everything and anything. Have you noticed how these health decisions become more nuanced as we age? What might have been a straightforward yes to all screening tests in your 50s requires more careful consideration in your 70s and beyond. Finally, let's discuss colonoscopy in the very elderly, particularly for those over 80 or with significant health problems. Colonoscopy has been incredibly valuable in reducing colorectal cancer deaths, but its risk-benefit ratio shifts dramatically with age and health status. The U.S. Preventive Services Task Force now recommends against routine colonoscopy for most individuals over 75 and strongly against it for those over 85. This isn't because colorectal cancer becomes less serious with age, but because the harms of the procedure may outweigh the benefits. Colonoscopy is not a simple test. It requires complete bowel preparation, which can be physically taxing and potentially dangerous for frail elderly individuals, sometimes leading to dehydration and electrolyte imbalances. The procedure itself carries risks of perforation, bleeding, and adverse reactions to sedation. These risks increase substantially with age and the presence of other health conditions. For every 1,000 colonoscopies performed in very elderly patients, studies show approximately 25 will experience a serious complication requiring hospitalization. Even more concerning is the time lag to benefit. When a precancerous polyp is removed, it prevents a cancer that would typically develop 7–10 years later. If a person's life expectancy is less than 10 years due to age or other health conditions, they're unlikely to live long enough to benefit from this prevention, but they still bear all the immediate risks of the procedure. I remember Doris, an 84-year-old woman with moderate heart failure, who was pressured into having a routine colonoscopy by a well-meaning gastroenterologist. The bowel preparation caused severe dehydration that triggered a heart failure exacerbation, requiring a week-long hospitalization. She never even made it to the actual colonoscopy. 6 months later, she was still working to regain the strength and independence she had lost during that hospital stay. All this for a screening test that was unlikely to extend her life given her age and heart condition. This doesn't mean all elderly individuals should avoid colonoscopy. For those with symptoms like rectal bleeding, change in bowel habits, or unexplained weight loss, a diagnostic colonoscopy may be entirely appropriate. The key distinction is between screening in healthy, asymptomatic individuals versus testing to diagnose concerning symptoms. If you're over 75 and your doctor recommends a colonoscopy for screening rather than to investigate symptoms, consider asking, given my age and health conditions, what are the chances this test will extend my life versus cause complications? And are there less invasive alternatives that might be more appropriate at my age? For many older adults, less invasive options like fecal immunochemical testing, FIT, may provide a reasonable alternative with much less risk. Have you or your loved ones faced decisions about whether to continue with colonoscopies at an advanced age? These conversations aren't easy, but they're essential to ensuring that medical care remains aligned with your overall goals. What ties all four of these screenings together is a principle that's rarely discussed in routine medical appointments: the changing risk-benefit ratio as we age. A screening test that makes perfect sense at 55 may no longer be beneficial at 85. This isn't about denying care to older adults, but about recognizing that good medical practice means different things at different life stages. There's a pervasive myth in our healthcare system that more testing is always better, that finding anything abnormal early is always beneficial, but the reality is far more nuanced. Every test, every screening, every medical intervention carries both potential benefits and potential harms. As we age, the potential harms often increase while the potential benefits may decrease. This isn't pessimistic, it's realistic. And making healthcare decisions based on reality rather than wishful thinking leads to better outcomes and quality of life. So what should you do with this information? First, don't make any changes to your healthcare routine without discussing it with your doctor. The goal of this video isn't to tell you to avoid all screening, but to empower you to have more informed conversations about whether specific screenings are right for you at this stage of life. Second, when your doctor recommends a screening test, ask questions like, how will the results change my treatment decisions? What are the possible harms of this test? Given my age and overall health, do the potential benefits outweigh the potential risks? And are there less invasive alternatives? Third, consider working with a geriatrician, a doctor who specializes in the care of older adults. Geriatricians are trained to consider the unique aspects of aging when making medical recommendations and can be valuable advocates in navigating these complex decisions. Finally, remember that the goal of healthcare isn't just to extend life at all costs, but to maintain the highest possible quality of life. Sometimes that means doing less rather than more, focusing on the health issues that actually impact your day-to-day well-being, rather than searching for problems that may never cause symptoms. You've lived a long life full of wisdom and experience. You deserve healthcare that respects that wisdom and works with you to make choices aligned with your values and goals, not just standard protocols designed for younger patients. Let me be clear about something important. This video is not anti-medicine or anti-screening. Early detection through appropriate screening has saved countless lives. The key word is appropriate. What's appropriate for a 50-year-old may not be appropriate for an 80-year-old. What's appropriate for someone with no other health conditions may not be appropriate for someone managing multiple chronic illnesses. Personalized medicine means taking into account your unique circumstances, not applying one-size-fits-all guidelines. Some of you might be thinking, but isn't it better to be safe than sorry? Shouldn't I get all possible tests just to be sure? That's a natural question, but it reveals a misunderstanding about how medical testing works. Tests aren't simply giving us information with no downsides. Every test sets in motion a series of events that can lead to benefits or harms. When the potential for benefit is low and the potential for harm is high, being safe actually means avoiding the test, not getting it. Others might worry, if I start questioning my doctor's recommendations, won't they think I don't trust them? A good doctor will welcome your questions and your involvement in decision-making. Medicine has moved away from the paternalistic model where doctors simply tell patients what to do. Modern medical ethics emphasizes shared decision-making, where you and your doctor work together to make choices aligned with both medical evidence and your personal values. If your doctor seems offended by reasonable questions, that might be a sign that you need a different doctor. And remember, you're not questioning your doctor's expertise or intentions. You're simply asking for the information you need to make an informed decision. That's not just your right as a patient, it's your responsibility. I want to wrap up by sharing a powerful concept in medicine called quaternary prevention. We're all familiar with primary prevention, preventing disease before it occurs, secondary prevention, screening to detect disease early, and tertiary prevention, reducing the impact of existing disease. But quaternary prevention is about protecting patients from unnecessary medical interventions. It recognizes that sometimes the greatest service a healthcare provider can offer is to say, "You don't need this test or treatment." As you navigate your healthcare decisions, remember that more isn't always better, newer isn't always better, and doing something isn't always better than doing nothing. Trust your instincts. If something doesn't feel right for you, seek second opinions when necessary, and never be afraid to ask, "Is this really necessary at my age?" Thank you so much for watching this video all the way to the end. If you found this information valuable, please give it a thumbs up and share it with someone who might benefit. These conversations about appropriate care for seniors aren't happening enough, and your share could help someone avoid unnecessary procedures and anxiety. If you haven't already, please subscribe to our channel and hit the notification bell so you don't miss our weekly videos on navigating healthcare decisions in your senior years. Remember, you are your own best advocate. Age brings not just challenges but wisdom, and that wisdom deserves a place at the table when making healthcare decisions. Until next time, take care of yourself, ask questions, and never stop learning about how to make the best decisions for your health and well-being at every stage of life.